Hello, I'm Mari Pampalona, and I'm a second-year student cursing the bilingual early childhood education degree at the International University of Catalonia. One of the subjects I've been cursing this semester has been music, plastic, and physical 1. In order to finish off with this subject, we've been asked to create a didactic content on a topic that has been discussed during this semester as a final project. At the beginning of my research, I didn't really know what to talk about. But I had one thing clear. I wanted to connect art therapy with our internal feelings. I was interested to see if art therapy could be useful in some way in any treatment of any sort of disorder. So I started investigating and found out about the borderline personality disorder. The question I raised myself was if art therapy could bring any benefit to the borderline personality disorder. So when I had my question laid down and knew what I wanted to investigate about, I had to organize a bit myself. So the methodology I used was really organized. I wrote down the different topics I wanted to investigate and talk about, and then I created an index along with a continuous investigation as I kept finding interesting things I wanted to add in my work while I was investigating. In order to make the whole work coherent, I had to do a brief abstract introduction and at the end of the work a final conclusion in order to sum up everything I had investigated and to be able to give my personal opinion. First of all, I would like to talk a bit about the theoretical part of my work. To start off with my investigation, I think it's essential to know what the concept of art therapy means and how it works. Art therapy is a form of therapeutic intention focused on healing psychological disorders, personal blocks, fears, and past traumas. Its main objective is for patients to be able to express their feelings, thoughts, and emotions. And it's used to improve cognitive and sensory-motor functions, boost self-esteem, self-awareness, autonomy, and spontaneity, cope with stress, and reduce and solve conflicts. How does art therapy operate, you might be asking yourself? Well, it operates the following way. The client creates art, and the art therapist, through the visioning of this art, can recognize some problems that may be affecting the client's emotions, thoughts, and behaviors. People attending art therapy cannot express what they feel or have lived verbally for different reasons, so expressing themselves creatively is a great way of communicating with others and expressing their own feelings and emotions. Another important concept that should be really well understood is the borderline personality disorder. This one is defined as having a dysregulated temperament and maladaptive character. It's chronic and severe, and it's the most common personality disorder. This one is suffered by almost 5% of the population, and it's characterized by patterns of instability in interpersonal relationships, affect and self-image, poor impulsive and anger control, and several forms of impulsive behaviors. Although borderline personality disorder can be difficult to diagnose because some features of this disorder match some of the mood disorders, it can be effectively treated through specific therapeutic treatments, obtaining satisfactory results and allowing affected people to have a more stable life. The next concepts I'm going to talk about are feelings and emotions. I have found it convenient to talk about them as everything I've just said before is in some way related to them. I'm going to first be talking about feelings. These one are mental representations of the physiological changes that distinguish emotions. These ones are direct results of emotions, they're subjective to nature, they're private, hidden from view, and difficult to analyze. On the other hand, emotions are momentary and ongoing disturbance within the mind caused by the discrepancy between perceived reality and one's desires. These ones are the repercussions of feelings. They're not subjective, they're not private, they're not evasive, and they're not undefinable. There's 5 basic emotions, which are fear, anger, love, joy, and sadness. Why are feelings and emotions important? Well, knowing how to locate where our emotions and feelings come from is absolutely essential, as in this way we can control the way we respond. One of the most important aspects of human beings is their own understanding to ensure better personal well-being. While I was doing my research, I kept thinking of how I could show the benefits art therapy has on borderline personality disorder. And while I was researching, I came across a case study and thought that what better way to understand the effects this one has than to see the results through an actual study conducted on a person suffering from this disorder. So this case study consists on 11 sessions of art psychotherapy with a patient diagnosed with borderline personality disorder. The participant is a 46-year-old woman who entered the emergency department due to an intentional overdose of prescribed medication. As a result of this incident, and looking at her medical records, it was thought that art therapy sessions could be a useful resource to her in order to express her cognitions, emotions, and needs. The process of this case study was the creation of art paintings reflecting what she was feeling. So in each session, she would create a different art painting. After this process of externalization, it helped the participant discover the relationship she had with the problems in a structured and non-blaming way. So, what we can extract from the results of this case study is that art therapy has a crucial role in psychosocial rehabilitation on consumers and affords several benefits. The participant was able to gain a better understanding of her traumas and experiences. She accomplished self-understanding and control and better interactions with others as she was in continuous contact with the staff. Okay, so after hearing a bit about the theoretical part of my work, I would like to talk about the conclusions I was able to draw after this whole investigation. At the beginning of the research, I was interested to see the benefits that art therapy could bring to the borderline personality disorder. And at the end of this research, I've been able to see, understand, and learn what these benefits are and how useful they are. I would also want to say that at the beginning of this investigation, I had never heard of this personality disorder, and I find it surprising as the number of people suffering this disorder is a public health concern, which I think should have a lot more importance than what it has nowadays. Taking a closer look to the benefits, we've been able to see during this whole process that art therapy has shown benefits for people with borderline personality disorders by reducing interpersonal difficulties like affect regulation and an unstable sense of self. It has also helped with getting better interactions with people and being able to express themselves openly, and the levels of self-esteem, self-image, and impulsive behaviors have also been improved. Although all of these benefits have a clear view on the patients, we have to remain mindful of the complexities that art therapy may present as we're evaluating individuals, which means that nothing is certain. Everyone is different and therefore reacts differently to same things. To finish off, I would like to say that I've really enjoyed taking part of this investigation. It has enriched my personal knowledge and understanding of things in great ways, and I've been able to see from a different perspective how people feel about themselves and how they view the world. Thank you very much, and I hope you liked it.